Have you ever let an injury go too long, perhaps with bad consequences? We're here with Phillip Adler to talk a little bit about what's called overuse injury. What is that?
Yeah, thank you. Overuse injuries are those things that don't seem to go away. Tendonitis, shin splint, jumper's knee, that patellar tendonitis, things where you might have injured yourself or it didn't quite hurt too bad, and you keep going and you keep going and you keep stressing that area, and then eventually it's just a pain that just does not seem to get any better.
So how do you treat an overuse injury?
Yeah, the first thing to do is we have to stop the activity that's really keeping that injury inflamed and keeping it going. So if you're a basketball player and you've got the jumper's knee, the patellar tendonitis, stop jumping, stop running. Shin splints, we need to stop running. We need to do some of the RICEs, the rest, ice, compression, elevation, ice 15 minutes. And at that point in time, it's with activity modification, meaning if we're cutting back or doing something different with our activities and it's not getting better, that's when we really need to seek the advice of a sports doc or someone who knows how to treat overuse injuries, because those overuse injuries that are let go for too long, they develop into other types of things where ice, ibuprofen, Tylenol, the basic things that we use to treat injuries may not be working anymore.
You have opportunities at Spectrum Health for people to really come in and see professionals and maybe kind of get something looked at that people have waited and hesitated, to really having that seen.
Yes, our Saturday sports injury clinics are a great opportunity to get those things that haven't quite gone away taken a look at. Our sports docs are in on Saturday morning from 8:30 a.m. to 10 a.m. From August through the end of October to really take a look at those things that might be lingering and not quite getting better.